at your two insulin bottles.
We only have one. You took ours because you said it was broken.
Okay, here. Okay.
Second one, did you fix it?
I tried to.
Okay.
Let's see how well it works.
Okay.
This has a funky top. Okay, this. Okay, so you've got two bottles. You've got one with an R on it, and you've got one with an N on it. Okay, so your R is your regular insulin. That's your short-acting insulin. When you look at it in the bottle, it should be clear. Even after you agitate it and you look at it, it should still be clear. If your regular insulin is not clear, don't use it. Okay, you get rid of it and you open a new bottle. Okay, then your bottle that's marked N, this is your NPH. This is a longer acting insulin than the R. The R is short acting. Does anybody know how long it lasts?
The R?
Okay, so the R generally lasts for up to 4 hours. Your N, does anybody know how long NPH lasts for?
8 to 12.
About 6 to 8 hours. When you look at your N, when you first pick up the bottle, you might see some white residue on the bottom. Agitate it the way Mr. Sadowski taught you. And it should look cloudy. It's normal. This is what you expect from your NPH. So a lot of times you will have people who have orders for NPH, and they also have orders for regular insulin. Do we want to give 2 injections? No, we really don't want to give any more injections than we have to. So you can mix the regular and the NPH. There's a way that you do it. So what you have to remember is that you want to keep the regular clear. And what some of you have figured out is that if you don't put air in the bottles, then eventually you lose your vacuum and you can't withdraw. So what you do, clean off your bottles. And we'll say that I'm going to give 5 of regular and 10 of NPH. So that's 15. So I'm going to draw up 15 milliliters of air. Or not 15 milliliters, 15 units. I apologize. So I'm going to inject. Now, how much did I say?
5.
Okay, 5 of the regular and 10 of the NPH. I'm going to inject into the cloudy insulin first. And I'm going to inject the amount that I'm going to take out. So I'm going to inject 10. And I'm going to withdraw that, and then I'm going to inject the remaining 5 into the regular. Now I'm going to go ahead and take the regular bottle, and I'm just going to move this as 1 unit. I'm going to draw up my 5. Now I'm going to come back to the cloudy insulin, the N, and I'm going to draw up my remaining 10. By doing it this way, I'm not mixing, I'm not contaminating the clear with the cloudy. Now I'm going to go ahead and recap my needle so I can.
I've had to use it,
So now I can go and give this to my patient. So the rule is you go from cloudy to clear, clear to cloudy. Okay, that way you're keeping your clear clear. If you get a little bit of clear in the cloudy, it doesn't hurt anything. But if you get cloudy in the clear, then that contaminates your whole vial and you have to throw it away.
Why would you give someone a mix of the regular and the NPH at the same time?
Well, sometimes you might have somebody who has an order for NPH, you give them before breakfast every morning. So a lot of times you'll see an order 20 units of NPH before breakfast and dinner every day. What also happens is that that's around the time that you're doing your AccuChecks, you're doing your blood sugar checks. So you'll time your blood sugar check so that it falls around breakfast time. Maybe your patient's blood sugar is 340, and you have a sliding scale. And it tells you at 340 blood sugar, you give 10 units of regular. So you would give that 10 units of regular in addition to your 20 units of NPH. And they happen to fall at the same time.
So you wouldn't wait for the regular one to kick in before you
No.
did your
Give them
blood
both.
sugar check?
Yeah, you give them both. A lot of times, if the blood sugar is that high, if it's 340, then a lot of times we'll do a random check a little bit later to see if the blood sugar is coming down. But we're not always going to do that. If it's 170 and we gave a couple of units of regular, we're not going to bother to check unless a patient becomes symptomatic.
And what if you're using the sliding scale? Do you mix them? You know, if they say it's between 180 and
Mhm.
2 something, would you
Mhm.
give both at that time as well?
Yeah, yeah. So that's what your sliding scale is. Your sliding scale is when your doctor orders blood sugars, AC and HS. What does that mean?
At bedtime and
Before?
or before, yeah.
Before meals and at bedtime.
Yeah.
Right, exactly, before meals and at bedtime.
Yeah.
So, most doctors will, and with almost every patient, you can come up with probably 2 diagnoses right off the bat. You can probably come up with some kind of self-care deficit and some kind of knowledge deficit. Okay, and so you've already got 2 right off the bat. And then chances are, it's not gonna be that hard to find a third one. Whether it's impaired gas exchange, impaired skin integrity, pain. Right? So you want to be holding it, yeah, at the end. Yes. Okay. You don't want to have your finger here
Ready to inject.
until you're actually ready to inject. Yeah, because you've got a grip, you've got control at this point.
That's
Right.
like this.
Right.
I was doing it as I was
Right.
looking at it.
So that's
Holding it
why
like this.
we want you to do it up here, because that
I was
way.
pinching and going. And
Just
then you were doing it like that.
Yeah.
To say I was.
No, please, don't ever be sorry for asking questions, because if something's not clear in your mind, then it's just always gonna bug you, and. Yeah. So,
Yeah.
don't ever feel bad about asking questions.
No, I wasn't asking for that.
Proper to hold it this way.
Yeah, yeah. You just
watch
keep her
out for
away
that.
from the plunger until you're actually ready to inject.
Did you see what she injected it?
Yeah, standing over there. Some people wanna go in,
Right.
holding it like this, but you could possibly expel some of the medication before you make your injection.
Okay. So then, we're allowed to touch this.
Yeah.
Yeah, you can touch it. So you can go in like this, and then do your injection.
Okay.
Okay? Because that way you've got complete control of this.